Smita here.
Good evening. My presentation is Tuberculoma in Pregnancy, a rare presentation. So India has nearly 21% of the global burden of tuberculosis among pregnant women with tuberculous meningitis manifesting in 5 to 6%. Non-specific symptoms delays the diagnosis in pregnant women. Early initiation of ATT and good compliance is needed for favorable maternal and perinatal outcome, which can otherwise turn fatal. So, in this case, there was a 21-year-old primary gravida at 4th month of pregnancy who presented in March 2024. She had complained of loss of vision in the temporal aspect of both eyes for the past 1.5 months. No prior history of any major illness, trauma, or prolonged medications were present. On clinical examination, we found that in both her eyes, her vision had dropped to 624 and N12. On the color vision chart, she was able to read only one plate. Pupil showed a RAPD in the right eye. Her EM are full, free, and painless. Both anterior and posterior segment findings, including the optic disc, was noted to be normal. So we advised her a visual field test along with a color fundus photo, out of which she only underwent a visual field test that revealed a bitemporal hemianopia. So she was advised an urgent MRI brain and orbit, which revealed a lobulated suprasellar mass in region of hypothalamus that appeared to arise from the optic chiasma and possible infiltration of both intracranial optic nerves and optic radiations. So an urgent neurosurgery referral was done, and patient was also counseled about the possibility of an MTP. Management, she was lost to follow-up, but presented back in July 2024 in the 7th month of pregnancy. During this intervening period, she had undergone a month of alternative therapy. She had developed headache following the alternative therapy and had presented in the ER of a multi-specialty hospital with headache, vomiting, and in a drowsy state in late April, where she was resuscitated, administered IV antibiotics. Here, she underwent a repeat contrast-enhanced MRI brain and a CSF analysis that showed a suprasellar mass, and CSF was gene export positive for tuberculosis. So her final diagnosis was suprasellar tuberculoma with tubercular meningitis in pregnancy. She was started on ATT and was under steroid cover. She was under combined pulmonology, OBG, and neurosurgery monitoring. She presented back to us in July and had worsened vision in the right eye, and both optic nerves by that time had showed pallor. Optic nerve pallor, worsening vision, and visual fields can be from both compressive neuropathy with contribution from ethambutol in ATT. So ethambutol was stopped by the treating pulmonologist to prevent any further drug-induced vision loss. MRI in August 24 showed a decrease in the size of the suprasellar mass, but involving pituitary stalk and few other enhancing small nodularities in the basal cistern. Her ophthalmological evaluation was done again in November 24, where the BCA in the right eye had improved to 624 N18 and in the left eye to 69 N6. Her color vision has also improved in both the eyes. She still had a grade 1 RAPD, and both the discs showed pallor. The right eye disc was more paler than the left eye. Her visual fields had improved since July 2024. Her child was 3 months old in November 2024, and child was also under ATT. So, conclusion is, tuberculoma in pregnancy is a rare phenomenon, often because features can be masqueraded by general features of pregnancy, thus preventing diagnosis. Increased susceptibility may be because pregnancy partially suppresses cell-mediated immunity in favor of antibody response, so reactivation of a latent TB is possible. Commonest presentation is with seizures. In our case, it was a visual complaint, which is usually rare. Successful treatment of neurogenic TB is possible even in pregnancy with proper medical measures. Thank you.
There was this lesion that was there in the pituitary area. Were there other lesions as well that had led you to the diagnosis?
Pardon, sir?
So she didn't have any seizure or any other sort of
No,
lesion,
no.
only purely a cellar. The picture
Initially, she had a suprasellar mass. When she had presented in the multi-specialty hospital, I couldn't access the MRI for that. She was drowsy, she had very headache and nausea, vomiting. There, they had repeated the MRI, and they found the suprasellar mass. But following MRIs showed a few nodularities in elsewhere also.
Because that can explain the systemic features more than just this. But yes, I mean, changes like this similarly, to the pituitary gland. Otherwise, also there is a, during pregnancy, apoplexy and all
Yes.
is also known for, because there is increased
physiology that was done pre or post? Why was the child on ATT?
Apparently, if tuberculosis is present in pregnancy, it's often the norm to treat the child also. I just got to know that from the treating pulmonologist. They give a
So what would be the regime for the child?
normal 6 months course.
Didn't expect that.
Yeah, that too for
Maybe it's just the close
tuberculoma.
contact. So that one may work actually from a chest TB. I mean,
It's an extrapulmonary
Yeah.
this thing. So
Yes.
in an extrapulmonary, I don't think that. But you should have referenced it since you are saying it on a platform like this. I think it would have been better if that was referenced or there was like some concrete evidence to that statement. This being an extrapulmonary one, I don't really sort of agree.